Mark Donegan, self-healing practitioner and educator, July 15th, 2021. Breathwork. I want to go over some of the finer points of breathwork really quickly, with emphasis on the exhale, because I always emphasize the exhale. If you want to look up Kundalini Breath of Fire on YouTube, I suggest that you do that. It's similar to a woman giving birth or a dog panting on the exhales. And you repattern your systemic self to respond with exhales rather than inhales. It's a repetitive practice that over time resets your autonomic nervous system to, rather than inhale when something happens or you speak or you go to move, rather than inhale and freeze and be slow and full of air, you learn to exhale before you speak and before you move, and then that makes you less pressurized and more available to movement and ease. You don't have to be still. Breath work is not still. The universe itself is not still. It's always in motion. So if you feel anxiety, it's there for a reason. It's natural. It's part of the universe. What you try to do is match your breath, your sync with the universe, with whatever breath work that someone teaches you. Again, I'm going to focus on exhale here, and I'm going to take my shirt off whether people like it or not, because I'm kind of skinny and I have a abdomen that you can easily see when I'm exhaling. So without further ado, okay, there we go. Okay, now I think we all know that you want to breathe in two separate chambers, top and bottom, and that you exhale first from your stomach, compress your chest, compress your stomach. Inhale first to your stomach, then slowly up, as some teachers will teach you, step by step, through your chest, all the way through your head, connect all the way up to the universe, and then back down. The important part here, it separates what I do and everybody else. I do repetitive exhales. Instead of inhaling here, I let my stomach fall out and act like a pump, pull more air out. And I push it out even to pull air out. And compress my chest down also. Push my stomach back out. Not inhaled yet. Not inhaled yet. Just finding more trapped places, pushing. And then I'll slowly inhale from top to bottom. I'm not going to do this real extreme right now. You can see how I feel. I spread my arms to fill my lungs, bring it up to my head, reach to the sky, bring the energy in through my fingertips, into my body. I'm still on the inhale, still expanding, using my mind to expand my body, forcing my hands out, forcing my energy out, bringing it in, back and forth. Even though I'm on the inhale and I'm pressurized, I still can move fairly fluidly. Watch what happens when I start to exhale. And I stay on an exhale. That's the thing. You can learn to stay on an exhale for a long time. Keep your mind there on your breath. And then you can learn to do other things and multitask as your breath is working away. You can engage somebody. You can even be psychotic, as I just recently learned. And you can continue on. And it's really a matter of how much time you put in yourself, by yourself, with whatever breath work you choose to work with, you know, working on, the full expansion, the full breath, the full movement on exhale, putting your mind everywhere to your body, the awareness, the mindfulness, the being here now, being within yourself, getting as far in within yourself. There's always a pain signal. There's always somewhere to go within yourself. Your body's always telling you something. And then the last thing I want to throw in on the breath work, because I think I've given you the importance of practicing the exhale, and it will give you an exhale when you need it, and it will pattern you to exhale more all the time as you should. The last thing I want to add is extreme breath work and pressure around the brain. People have a misconception that, like practicing extreme breath work, that maybe you're going to have a stroke or something. Because I'm at risk of stroke, so I want to talk about this because I have pressure around the brain from spinal issues. And I was just practicing some extreme breath work, actually with marijuana, because you do the same thing. You inhale it and you bring it into your body and you use it and you send it to places in your body where you need that pain relief. But it also puts pressure on your brain, especially the way I use it, and I've taught it in other videos how to use marijuana, how to get the most out of the plant into your body. And some people think that kind of breath work is dangerous, and I was just thinking about divers because I've been around a lot of people that, ocean swimmers recently and divers and people who do breath work in extreme ways like that. And I've heard of some of them people having strokes, but not very often. They probably had some underlying problem. But essentially, I mean, unless you're doing that really, really extreme stuff, I really don't. Yeah, and you've got to understand, like a diver has pressure on, the water because I sort of quit doing that myself. I noticed years ago I was having issues. My older brother had issues and had to quit diving for the same reasons. So there's physiological issues with, getting underwater, making the pressure in your brain worse when you're doing breath work. But when you're not underwater and you're doing extreme breath work, as long as you're staying in your mind, because I was taught how to push right to the edge of consciousness, and I was just doing that, and that's why I was bringing this up. It was having no effect on my brain as far as damage. I would have had to. I don't even know if I could have done it. Like trying to hold my breath, turn blue, because I don't think I could have. So when you've done those types of exhales, and then you're taking like a big, huge inhale, I don't really think. And I've never heard of that from any like the Kundalini yoga people that do the breath of fire. Well, they warn, they give warnings. I'm not sure they're lethal warnings. I'm actually not sure what their warnings are. And actually, I've watched their YouTube videos. As far as some of them, they give no warnings at all. They give no disclaimers. And so, I'll at least give you that. Some of this stuff is dangerous, and some breath works are dangerous. I put that again out in other videos. And there's also meditations that can be dangerous. But anyways, wine, exhale away. It's not dangerous. Your inhale is automatic. I don't think you can inhale and hold your breath for too long that way. It's just kind of painful, and you're going to actually you're going to breathe in and then exhale again. And the last thing I want to throw in is that this type of breath work, that exhale concept, is something that I've used many, many times, pre and post surgery, pre and post conflict. Going and setting my brain, I'm going to exhale my way through this. And then what happens is you do have some rigid inhaling where you don't inhale fully. You're just inhaling enough. And you'll just have to wait you get through whatever trauma it is and do some more breath work to release that, like the types of things that I'm doing now. So again, exhales, Kundalini breath of fire, if you want to look up the exact mechanisms. And I can tell you that if you watch theirs, I just simply slow mine slower because I'm feeling, I'm multitasking, and I'm moving and releasing different places with every exhale. And every time you exhale and inhale more fully, you will exhale more and more each time if you stay with it. Again, it's a great, great, great practice to do. All right, that's it. 10 minutes, not bad.